I'm liking coming on live and then also then recording videos and posting those. I'm realizing they're reaching different people, and I love how these conversations are going, and I want to continue this. So just to kind of give you an update, I'm gonna just keep starting these the way I always started, and my weight and height and all that good stuff, because I used to really I was obsessive about that when I started watching people's vlogs and stuff. Not much has changed. I'm down, I think it was down like another pound today. Not doing too much in regards to, I'm dieting. I'm kind of doing intermittent fasting, playing around again with keto. But I am 11 years post bariatric surgery. And like I've talked about in some of my other videos, bariatric surgery is just a tool. And so I have gone up and down on my weight. But I can't actually do this here. I'm here at home, not at our studio, but this is what I look like. I'm about a size 12, 14 or so. I'm 5'8", about a size large top. I'm 42 years old, 5'8", 193 pounds, something like that this morning, somewhere in there. And I feel my best, I'd say, for my size with not having skin removal surgery. I feel really, really good around about 167, 170 pounds. And then I think if I ever get my skin removal surgery, that would be a fun thing to post here on YouTube, because I would love watching women getting their tummies done. So I've got about 10 pounds or so of skin that needs to be removed after losing, I used to be upwards around 300 pounds. But I want to jump on and just discuss this topic, which is transfer addiction. If you don't know anything about transfer addiction, or you haven't heard of it, it's also called replacement addictions, transfers addictions, same kind of a thing. It's where you take one compulsive behavior and you move it into another avenue. So in respects to bariatric surgery, we have to get by people in the bariatric community have chosen to have either some rerouting done with certain surgeries, Roux-en-Y, stuff like that. I had the vertical sleeve gastrectomy, meaning they removed like 80% of my stomach. So my intake is very, very little. I can only still, even 11 years post-op, only about 2 to 3 ounces, and that's it. Still eating and drinking at the same time is very, very difficult for me, even 11 years post-op. And when we have to have part of our stomach removed, is probably because we have an eating disorder and or an addiction, a compulsive behavior. So bariatric surgery limits the amount of food that we can actually physically take in, which is awesome because we just automatically lose weight. But there's very often a reason we have that compulsive behavior. I talked a little bit about being diagnosed with ADHD, dealing with anxiety, depression, things like that over the last couple of years, and realizing that sometimes those compulsive behaviors were to fulfill a need or get a dopamine release. When I no longer had food as a compulsion or as a way to deal with the need for a compulsive behavior, it's really easy to want to find something else to give you or somebody a dopamine release. And, I was looking up some just statistics because I like statistics and I like studies, and bariatric surgery has been around for a while now. So there is actual real studies. And I read one website, it's bariatricpal.com. And they said, oh, it's not that big of a deal. And they said it's only 1 in 3 people that deals with a transfer addiction. And I said, it's so interesting that they see 30% as not a big deal, that 1 in 3 developing a transfer addiction is like low. Like, actually, that's quite a bit. And a lot of people within that 30% that develop, or not even develop, they just transfer their compulsive behavior goes to alcohol. And it's just an easy way for somebody post-bariatric surgery, because we have a sleeve, and so it's easy to get the alcohol through our system, and we metabolize it very often, very differently, and so less alcohol has a bigger effect on us, but it's also out of our system faster too. So people tend to binge more in respects to alcohol and can develop alcoholism. and many die later, unfortunately, from alcoholism, from liver disease and things like that. So I'm just going to talk for myself. I'm not going to talk for anybody else, but that is the statistics. But I have dealt with some pretty detrimental, we'll call them, transfer addictions. One, the compulsatory issue that I've struggled with, and I've talked in other videos, was the chewing and spitting out, which is a compulsatory behavior. It is a form of an eating disorder that most people would call bulimia. And since I couldn't really swallow it and throw it up, I was chewing and spitting out. So my compulsatory behavior, I noticed, especially when I wasn't eating properly. So it's like I had, my body, I think, was actually physically hungry. And so I was, I was like needing the nutrition, but I didn't want to gain weight. So I chewed and spit out donuts, and I was compulsatory. And I think I talked about it in my Adderall video or my ADHD video. A lot of it was to help relieve stress, because I had a lot of anxiety and stress, and that did help, like, with a dopamine release. But I think it really was bigger than that. I think that I was very undernourished. And part of that has to do with the weight loss surgery. But honestly, like, if you're really honest, when you're obese, when you're fat, you're not necessarily fat because you're eating a ton of salads and like really high nutritional value food. We're probably eating processed food, a lot of carbohydrates, a lot of simple sugars, and a lot of things that aren't really even feeding our bodies anyway. So I know that I went into bariatric surgery already undernourished. So I was fat and I was 300 pounds, but that didn't necessarily equate to healthy. Now, I am going to say people can be overweight and healthy at the same time. I was not one of those people. And when I went into bariatric surgery and they removed my stomach, I got fat because I was eating like shit. I was eating carbs, and I was eating simple sugars, and I was eating things like that weren't already feeding my body. So then like now I can't eat as much food, right? And I'm already undernourished. And so, what do you do? Well, the trigger for me for compulsatory behavior and transfer addiction was the chewing and spitting out of a dozen donuts, because I think my body was starving for nutrients, and I was not choosing the correct food to eat. I didn't start developing like alcohol things until 2020, until COVID. And once COVID hit and the stress, and I was just stuck here in the house, and I kind of worked through some of the compulsatory chewing and spitting out foods. I had done a lot of like work there, and I wasn't doing that. And I'd put on like a little bit of weight. I was about the weight I am right now. And then I slowly got a little bit heavier through COVID, like, because we weren't moving our bodies, and then like day drinking became acceptable. Like, you saw it all over social media because that's what people were using. There's studies coming out about that as like acceptable alcoholism, like functional acceptable alcoholism. And I started drinking red wine, and it would just like, I was dealing with so much anxiety, having 2 kids here, going to school, and being in the entertainment industry, and moving multiple weddings over and over and over, not sure if we were going to lose our business. And it was very stressful. And then we dealt with the riots here in California, and our studio got hit in riots, and we're a Black-owned business. My husband's Black. And so we were dealing with just all of that stuff that was going on. And it was just a lot. Like, it was a lot. And I'm not saying that that's an excuse then to drink, but that was kind of my excuse, or I was like looking for anything, because I was literally imploding. Like, I just couldn't function. And then I was sitting here at the house all the time. Oh, and we got all 3 COVIDs, fun fact. And now I'm vaccinated and boosted, and we still got all 3, original, Delta, and Omicron this January. So like, I felt like we were getting hit by like all sides. And I would be sitting here like stewing, and I couldn't do anything. And then not realizing I also had ADHD and was going all over the place, I started drinking more. And like I said, it became very acceptable during COVID to drink. And so I kind of looked around, and I'm like, oh, like the joke is it's 11, it's time to make a cocktail, or it's 1 and it's time to pour a glass of wine. And the acceptability for drinking allowed me to open up that portal, for lack of a better term, and say, think I might try that and see how, if that calms my nerves. And it worked a little bit. Then I realized I was like, I'm drinking every day. And I didn't necessarily have to drink, but I started feeling like if I don't drink, how am I going to go to sleep? And most of my drinking was happening in the evening, like after my kids would go to bed. And then I was like, oh my gosh, am I dealing with alcoholism? Like I'm drinking too much. Excuse me. I reached out to my doctor at that point and was just very transparent and honest with her. And I said, I don't want to become an alcoholic, even functional alcoholic. I have struggled with that, not with alcoholism, but just with compulsive behaviors like eating and things like that. And so when we did the assessment for ADHD and she suggested Adderall, which is what I'm taking now, I said, well, don't people use that like wrong? And she said, absolutely. Some people use it inappropriately, which is why we decided on the doses that I'm going to take and fast acting versus long acting. It's how we kind of came up with like my regimen. And I noticed once I started that medication, like the desire to drink was almost zero. And that's where I realized I was using alcohol as a medication almost, to calm my anxiety, to slow my brain, things like that. And I realized that's why I transferred where I used to use compulsive eating to help with my stress and my anxiety and my overactive mind. I then transferred that into like kind of overeating again, gained some weight, gained like 40 pounds back, stuff like that. And then realizing like, I don't want to gain all the weight back. What else can I use? And I'm sitting here at home and I'm stewing and I'm crazy. And I'm like, oh, apparently alcohol's okay now. Let me try that. Went to that, realizing this isn't healthy. I'm drinking every day. That's not a healthy way to be. And I'm not getting anything done. Like I feel sick all the time, waking up hungover in the morning and realizing I'm not just having a glass of red wine. I'm having a bottle of red wine. And I slowly was putting weight on. That's how I got back up to like 208, which isn't like 300, but like it would be 300 if I didn't stop it. Okay. So then I got assessed, put on Adderall. Then my anxiety was like, am I going to transfer that behavior? And I don't even want to call it transfer addiction. I almost want to call it like a transfer, like a behavior to compensate. Am I going to, if I took food and then I transferred that to say alcohol, and then I take alcohol and I transfer that to Adderall, like I don't want to become like an Adderall addict either. And so what I'm learning, and so what I will say, Adderall helped with the reason why I was having compulsive behaviors. So for first of all, my need for compulsive behaviors has significantly declined because we got to the innate portion of my problem of why I was overeating to begin with, which is why I went to alcohol as like a medication and then now Adderall. That being said, because I think I have a personality type that I have that kind of personality type that could go to an addiction, I tend to like extremes. I tend to be like, I can use work as a transfer addiction. I will like overwork. And then I'm like, no, I'm not just going to have one job. I'm going to have 7 jobs. I'm not going to book just 20 weddings. I'm going to book 70 weddings. Like I'm that personality type, which is not a healthy personality type. I recognize it in myself in my 40s now. But I did that with weight loss where I'm like, I'm not 300 pounds now. I'm 200 pounds. I wonder if I can get to 140 pounds. Your girl here can't get down. I can, but that's like a sick, disgusting weight for my personal body type. I like extremes. And so I think the 30% of patients, 1 in 3 that develop a transfer addiction is a high number. And if you are pre-op and you're looking into bariatric surgery as possibly being a tool to help you lose the weight, if I can make any recommendations is get to the core of why you are binging, why you are overeating. People say, well, I can't lose weight without it. You can, you just have to restrict yourself from eating the amount of weight. Eating the amount of food that is causing the weight. The only thing bariatric surgery does, specifically the vertical sleeve gastrectomy, but any of these essentially not allowing you to eat that much food, it's forcing you to eat less. So if you can't force yourself to only eat 2 ounces or under 1,000 calories, which is what you like your first 6 months look like, by the way, anybody can make themselves do that. But it's here, right? And the surgery just limits that and it forces you to do something. So once you're forced to do it, like you couldn't do it before the bariatric surgery, because there was something that wasn't letting you do it, whether it was anxiety, whether it was an overactive mind, whether it was depression, whether it was, whatever it was, you had a compulsory behavior that really at some point is going to need to be addressed. Or you're going to transfer that addiction into something else that may or may not be positive. So I've seen a lot of people that are specifically creators. So that's how I've seen them. Doesn't necessarily mean that all creators do this, but I've seen a lot of creators get hardcore and almost compulsatory for working out to like an extreme. And so they've thrown all of that compulsatory behavior into the gym. Now, somebody can look at that and go, well, that's really healthy. It is. It's actually very, very healthy for them. I've seen it almost to a negative. Anything in too much is going to be a negative. So I think just being very self-aware, having checks and balances, I think is really important. Being very honest with yourself of like, even when it hurts and it's embarrassing and it kind of sucks to be like, oh, shoot, maybe I do have a little bit of an addiction. Putting a name to it, acknowledging it, and then addressing it and figuring out why you're making those choices is going to be for long-term success. So one of them is the transfer addiction. The second thing that you're going to come across if you have bariatric surgery and you do not address these compulsions and you do not address these binging things that we all do, you're going to put your weight back on. It's going to go back on, because if you don't transfer it and if you don't transfer the addiction to something else, or you don't figure out why you had that compulsatory behavior. So those two things, right? Probably this is the one we want, fix the problem so that we don't transfer it and become unhealthy in another area, right? Then the only other thing is you're going to go back to what you know, and that's overeating and getting those calories in to get a dopamine fix, because that's what all this is. So, and the failure rate for post-bariatric, people go, I don't understand how you got fat again. Like, I don't understand how you put on another 100 pounds or 150 pounds. I don't understand how my cousin put 80 pounds back on. She doesn't even have a stomach. You said, Christina, you just said right now, it restricts it, so you shouldn't be able to put it on. Raise your hand if you're in the bariatric community and you've put weight back on. We all have, because we're smart. Because we can drink our calories, because we know ice cream will go right through our sleeve, because we can munch all day and we can take in 3,000 or 4,000 calories throughout the day if you're just going a little bit, and you chase it down with a soda, or you chase it down with a sugar coffee, like your girl has right here, but it's sugar-free, Tawny, right? We know how to gain weight. We wouldn't have had to have bariatric surgery if we didn't know how to put on weight. We do. We know how to get the food down, and we know how to get our fix. So this is something, and really why I started this channel back up, that I personally feel like I gotta get my shit together. Like, I have to figure this out. I have to see, like, I had to go to a massive extreme to lose over 100 pounds and to keep it off. But what I really, really, really don't want to do is transfer that into another unhealthy behavior. So for me on this journey, the way I'm trying to pick that straight path, why are you compulsive? Why are you over the top with everything you do? Why, what is it? Are you trying to prove something to yourself, to somebody else? Are you trying to seek some validation? Like, where are you going with all of this? And so if I can challenge you, if this is something that's like kind of even speaking to you a little bit of like, maybe I do have a little bit of a transfer addiction. Let's have a conversation about it in the chat or message me or whatever. Like, I'm so fascinated when people can be self-aware and then start looking at this and go, oh, I didn't even realize that this is what I was doing. And sometimes we can figure that on our own. I have a life coach. I have a coach that I talk to every week who's kind of like a therapist, but a little bit different than a therapist, where we talk about these things and we really, really, we really need to delve into ultimately why we're making these behaviors. Okay. So message me, put in the chat, and then also let me know if you're having any other questions or any other things that you're like, I would really like to learn more about this, or this is something I've struggled. I had some people in there talking about that they have put on 80 pounds and that there is no community and they're feeling kind of like a failure because they've already had their stomachs removed. And so now what do we do? I really feel like this is the crux, you guys, of figuring out why are we being compulsive? Why can't we stop ourselves from eating? Why are we transferring this or going back to our original source? Just know you're not alone. And that this is a lifelong journey. Just so you know, I think a lot of us went into bariatrics, the surgery and this thinking that this was the fix, even though we kind of knew it wasn't. Like we would say, we would do all the like what we were supposed to do, but like kind of hoping that we could put this chapter behind us, that we didn't have to always think about our weight, that we didn't have to always obsess about being heavy, that we didn't always have to think about everything that went into our mouth. Okay, you're not alone. Like I would venture that it's 100% across the board that we're all struggling with this. There is not one person that's had bariatric surgery that reaches their goal weight and is like, so I'm totally fixed. That was cool. And then they don't think about weight anymore. Show me. If you're that person, message me, prove me wrong and tell me how I'm wrong. Because I'd love to be wrong. Maybe am I the drama, as they say? I don't think I am. I think that's why their failure rate is high. And because we really want that quick fix, and because we want this to kind of be done, and because we don't want to maybe sometimes address the bigger issues at play, we all just kind of go, oh, she failed. Like it's this, we all expected it, but nobody's talking about, I don't know, what is it? Like, is it an addictive personality? Why do we have the compulsion? What is it? And how do we fix it? So let's work together. This is a friendly, fun space. Love you guys. Message me. Talk to you later. Bye.